I think you introduced it great with the fact that we have a plumb line for ideal posture. The ear, shoulder, and hip. Now, we got the ear and the shoulder talked about with Kurt, but the hip. Now, in terms of the hip, there are muscle length discrepancies that can lead to altered positioning of the lower back, as well as just generally, as you get tired, you flex forward. And we talked about here, but if you look here, the lower back also rounds out, okay? What that leads to is a lot of increased pressure through the disc, through the joints, which can lead to insidious onset of low back pain, sciatica type pain. Go ahead and sit back up. So,
thank you.
Isn't that nice?
Yeah, that's nice.
Being supported at the lower back, you expect to have a small curvature here, okay? A test I like doing is if you stand just slightly rounded, you touch the lower back, you feel all those muscles firing, and then you come back and you come straight up, and all of a sudden you feel the muscles relaxed. Same thing with sitting and standing. You want to have a small curve in the back. Now, Kurt, go ahead and sit on the edge of the table. What we're going to do is just an easy test for muscle length, specifically the rectus femoris and the iliopsoas, your hip flexors, the ones that bring the knee up this way, okay? Now go ahead all the way back, and then bring this right knee in towards your chest, okay? So, what you immediately saw was this leg rise up this way, okay? You want it actually to go down a little bit past the table. So what this means is his iliopsoas is a little tight. And then bringing this foot in this way, you want it to pass 90 degrees right here, okay? So his rectus femoris actually isn't bad. So his main contributor to any postural imbalance at the hip and lower back is going to be from the iliopsoas. So, as with many of our examination and evaluation findings, this can be a treatment for him. He can use this stretch to improve his pelvic and lower back posture. Go ahead and sit back up. And then lie all the way back down and scoot down. Now, hamstrings are also a big, big troublemaker.
Oh, yes.
So, the hamstrings cross at the knee and at the hip. And we sit a lot, so they get very, very, very tight. Now, as that relates to the lower back, if the hamstrings get tight, it actually reduces that curvature to be a little bit straighter, okay, which leads to increased pressure. This is just like him having that flex posture and seated, but in standing, the hamstrings are what's pulling that down. So if he has tight hamstrings, he needs to stretch these out to decrease the pressure through the lower back and decrease the risk of having back injury. Go ahead and stand up for me. Now, what we haven't really talked about too much are the hips. Just like in the upper spine, we have the periscapular muscles going through. We also have the glute med, glute min, the rotators, the deep rotators of the hips, which can be troublemakers because they're often weak in the general population. Yeah. Now, this is going to happen over time just because we as humans are flawed, lazy creatures. So they're going to get weak. It's not something that you'll see people often on the abductor machine at the gym going, yes, I'm doing great, I'm getting my abductors. No, not beauty muscles. However, as it relates to stability, core, hip, and pelvic floor all tie into each other intimately for stability of the lower back.
Kind of creates that girdle.
Exactly, exactly. Which, when you think of the lower back by itself, structurally, this area doesn't really make too much sense without the muscles. This feels like it doesn't have much support. However, when you bring the musculature in, you get the glutes on the back, you get the transverse abdominals girdling around, the strong rectus femoris, the internal obliques, the external obliques, and all of a sudden you have this nice, what'd you call it?
Support structure. Like
support structure.
Girdle.
Yeah. Girdle, yes, girdle, coming all the way around to keep this solid, to keep this supported throughout the day. So working those deep abdominal muscles, the hips are extremely important for lower back posture in general. Now,
when you think about the bracing that people utilize too, what it does is it basically teaches those muscles not to work anymore.
Exactly.
So I've had a lot of patients in the past where, you know, they're lugging 200 pounds at work and they have a back brace but they don't injure themselves at work. They're injuring themselves at home when they don't have the back brace anymore, and they don't have those muscles kicking in to offer that support, and they're bending over. And that's just to pick up a piece of paper off the floor. I had one patient that happened to,
Yeah.
and blew out his back just doing that.
Exactly, and it can be as simple as that as far as the lower back. It can be the simplest movements that can lead to problems with the lower back, which is why preventatively we need to keep those girdle muscles, those hip muscles good and strong to make sure long term you live a long, happy life, injury free.
Back pain free and neck pain free. And
Exactly.
yeah.